I call Dr Shane Retty.
Thank you, Mr Speaker. It's a pleasure to stand and speak positively and affirm this bill, the Health Practitioners Bill. Mr Speaker, fundamentally and substantively, this bill is administrative, renaming the terms medical practitioner to health practitioners, thereby increasing the scope and the number of people that can be engaged. The purpose of this will be to increase efficiencies in the health system, and it will do so in several ways. First of all, health practitioners will be able to deliver better end-to-end service without having to do segments of care, then have a medical practitioner intervene and then complete their care onwards. So end-to-end care is better preserved. It also prevents skills dilution. When you have highly skilled practitioners who have to undertake sometimes labour-intensive repetitive work, you get what's called skilled dilution. They lose their career path and they lose interest. They move out of what they're doing. So a bill like this also prevents skills dilution. Mr Speaker, most importantly, what it also does is it allows more clinical people to do more things. And I think this is useful in resource-depleted areas particularly. Mr Speaker, some of the things that this bill will do is amend the ACC Act 2001. This allows a health practitioner leading the case to be involved in the individual rehabilitative plans. Now, many times that practitioner may actually be a physiotherapist, a podiatrist, maybe even a chiropodist. And the health practitioner is also able to prescribe various aids and appliances. So the theme here is that the health practitioner with the most knowledge is able to contribute. And I think that's the way it should be. Mr Speaker, the Burials and Cremations Act 1964 is also amended, and particularly it allows nurse practitioners to complete certificates of causes of death. Now, this is a very important function. The certificate of cause of death is very important for epidemiological studies. It gives us some sense of trends of death and trends of disease over time. It's actually also a very important closure for patients. I've often found that when they've got that certificate of death in their hand, they can look at it and in amongst their grief, that episode of sadness reaches some level of closure. Mr Speaker, Section 46B addresses this and talks about how a medical practitioner or a nurse practitioner can complete a death certificate. And if I could just go over some of those clauses. First of all, it applies to a person who dies of an illness. So if you succumb due to an accident, you go to a coroner's inquiry. It also says that it has to be of a natural consequence, and the section also says that a health practitioner has to reasonably consult with any other health practitioners who have been involved in the last illness. There's some safety clauses in this section as well. A health practitioner or a nurse who attended the person may refuse to give a certificate of death if a previous practitioner can't say, yes, I think this was due to illness. Another safety clause is a medical practitioner or nurse practitioner must not give a certificate of cause of death unless they've taken into account previous medical records, circumstances of the death, and of course examine the person's body. The final safety clause in this section is that the certificate of cause of death must not be given if the death must be reported to New Zealand Police or to a coroner. So I think there's a number of safety clauses there. Now, Mr Speaker, when you do a certificate of death, it's actually quite a time-consuming event. You need to coordinate with the funeral director to be at the funeral parlour. And so you coordinate schedules. You go, and then the very first thing you need to do is you need to certify that the person's dead, of course. There's a number of ways clinically to do that. What you then do is you complete some documentation that says, did this person have a notifiable disease or any sort of disease that the funeral home might need to know about or that the public needs to know about. You're then asked, have they had a pacemaker? Because if they're going to be cremated, you can't do that because pacemakers explode under cremation. And then you actually do the certificate of cause of death. Now, in my experience, this is probably 30 minutes, 35 minutes, sometimes 3/4 of an hour. And to have this done by an appropriately qualified person, I think, is a really good thing. Section 46B also specifically talks about nurse practitioners, and our colleagues across the House have talked to them today. These are indeed highly trained professionals, many of whom actually have prescribing rights as well. In fact, just on Friday, I tried to prescribe the Tamariki Order nurse in Nelson to become a nurse practitioner, a prescribing nurse practitioner with Te Piki Oranga she was with. And we've tried to enlist nurse practitioners up into some of our resource-depleted areas in Northland. But nurse practitioners, they really do have a high scope of practice. They're registered with the Nursing Council in a registered scope of practice. They've had a minimum 4 years of experience in specific areas of practice. They've actually completed a clinical master's, and they've passed an assessment panel as well. Now, when I looked at the Nursing Council website a few days ago, there's actually 116 nurse practitioners. And we've just talked about the Burials and Cremations Act. It strikes me that there are 3 registered nurse practitioners who might especially benefit from that act. And these are nurse practitioners with scopes of practice. There's only 3 of them in palliative care. Yeah? And the 3 of them come from Auckland, Canterbury and Southland. Now, Auckland and Canterbury may well be well served by medical practitioners and other services that can complete certificates of cause of death. But I'm pretty sure Southland will be very pleased to have a nurse practitioner who can complete some of this documentation. Mr. Speaker, this bill also amends the Child, Young Persons and Families Act 1989. Health practitioners are able to prescribe and undertake medical examinations. The duties of care for a health practitioner to align with medical practitioners is also amended. Mr. Speaker, I'm always sort of interested in what health policy we enable, how many people it might actually touch. Is it a few or is it many? And I think it's actually the amendments to the Holidays Act 2003 where this legislation may actually touch the most New Zealanders. If we look at the efficiencies this bill creates, let's take your standard practice and how we actually complete a sick note. So the patient comes in, you then consult with them. What most of us would generally do is then show the patient through to another room and the nurse completes the sick note. They then were required to come back to you to sign it, and then it was complete. Well, that could be 45 to 50 minutes for a patient. That's a lot of time. What could happen here now, the workflow is that they could be seen and diagnosed by a nurse practitioner or an appropriate health practitioner. The sickness certificate can be done. They're all complete in 15 minutes. Now, this is particularly so if the nurse has high skills for some of the more frequent things that we see sickness notes for, like a UTI, a urinary tract infection, for example. This can often be tested, POS, point of source tested, in the surgery. It doesn't need to see me. It can see inappropriately.
I'm sorry to interrupt the honourable member. The time has come for me to leave the chair. Order. 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 I'm on my feet. Members, this debate is interrupted and set down for resumption next sitting day, and the House stands adjourned until 2 p.m. tomorrow.